the series of case-based question in pharmacology. Today we will discuss a case of petit mal epilepsy. Here case is parents of a 7-year-old male child complained that at times suddenly the child stops all sorts of activity, keeps staring to some object and fails to respond to their commands. Clinical examination and history suggest that he is suffering from absence seizure or petit mal epilepsy. And the questions are: enumerate the drugs used for the management of above case. And the second is which drug you select for the management of above case and justify your selection. And the next question is mention the duration of the treatment of the given condition. And are you going to give any non-pharmacological advice in this case? If yes, mention them. So first and foremost, which are the different drugs which can be used for the treatment of petit mal epilepsy? Here there are two types of agents. One is the drugs or agents that are used as a first line therapy, and second, the drugs which are used as a alternatives. In first line therapy, sodium valproate, ethosuximide and lamotrigine, while in the alternatives there is clonazepam, then zonisamide and levetiracetam. At least you have to write the first line drugs, and these are sodium valproate, ethosuximide and lamotrigine. Now the next is which agent you will select out of all these. So obviously you have to select from first line agents. Now which are the first line agents? Sodium valproate, ethosuximide and lamotrigine. Now sodium valproate and ethosuximide, it is older, these two are older drugs, while lamotrigine is a relatively newer drug, but it is available in market since a decade. Okay, so it is not actually a newer drug, but newer as compared to the previous two. Now out of the previous two, one just have to be very clear that from the clinical picture, it is not obvious that patient is having only petit mal epilepsy or absence seizure. Many a times the patient is having associated petit mal as well as the grand mal epilepsy. And you all know that ethosuximide is a narrow spectrum anti-epileptic agent, and it is effective only against absence seizure, while sodium valproate, it is having a broad spectrum action, and if the patient is having associated some other epilepsy, then also it is effective, and that's why out of these two one has to prefer the sodium valproate. Okay, and one can also use lamotrigine, but if you have to select any one, then your answer should be sodium valproate. Okay, so the selection of the agent, that is sodium valproate. Then the duration of treatment of anti-epileptic therapy. Now for any epilepsy, once you start the therapy, once the patient is stabilized on a particular dosage regime, then therapy must be continued after, not only after the initiation of therapy, but once the seizure is controlled with that therapy. So 2 years of seizure free interval, that is required. Okay, and if again, now again one should be very cautious that the withdrawal must not be abrupt. There must be gradual decrease in the dose of the drug over months, and at the end of the 1 to 2 year again one can completely stop the therapy. So one can say that 3 to 4 years after the seizure free interval, one can stop the anti-epileptic therapy in case of petit mal epilepsy. And here there is a one advantage, that as it is a petit mal, so the chances of the recurrence will be very less. Okay. And the last question is which non-pharmacological advice you will give. Now Epilepsy is considered as a stigma, but there are certain precautions that one has to take, like avoid the driving, then avoid working with the machinery. But here in this case, it is a child. So the advice that you have to give is avoid certain activities alone, like bathing or swimming. One should be accompanied. The child should be accompanied with someone. Then, if the child is playing or working at height, it should be avoided. And very important is parent have to given a clear instruction regarding the importance of the drug therapy. One must not interrupt the therapy in between, and make a diary regarding not only the dosage regime for the but also the seizure chart also. Fine. So these are the non-pharmacological advice that are required. So this is all about this case. We will meet with the next case very soon. Thank you.